Oh, but I will say, Alex did mention in her like speech that moms are like feeding their kids Cheerios, which are a part of the WIC package.
This morning in America, millions of moms are serving their children Pop-Tarts and Cheerios. What they're really serving them is this.
So maybe that is as close as you'll get to any mention of WIC or SNAP.
Welcome back to Making It Awkward. I'm clinical dietitian Jessica Wilson and author of It's Always Been Ours. You can find me on Instagram at jessicawilson.msrd. You can watch the show on YouTube and catch all of Jen Jacobs' elite video editing over there. To support this independent podcast, you can rate it, you can review it, you can subscribe, you can send it to a friend. You can join the Patreon for as little as $3 a month to help it be sustainable. You can also email the pod at makingitawkwardpod@gmail.com. People in America are hungry. In a country of billionaires where food should be a human right. In 2024, 18.4% of households, or 6.7 million households with children, were food insecure. Unfortunately, that 2024 data will be the last we get for years because the Trump administration announced that it will no longer collect data on food insecurity in the U.S., saying that it is, quote, redundant, costly, politicized, and extraneous, which makes sense for them because Americans won't know how ineffective and harmful this administration truly is to Americans. As of this month, 4.3 million people have lost their SNAP benefits or food stamps, and that number is only going to grow as people attempt to renew their benefits and the work requirements for SNAP go into effect. Secretary of the USDA, Brooke Rollins, said that, quote, we now have moved 4.3 million Americans off the food stamp program. A lot of that is fraud. A lot of it is people taking the program that shouldn't have been. And a lot of it is just a better economy. We've had wage growth that has outpaced inflation for the first time since early 2021. This is a really big day, so people don't need food stamps, end quote. In this episode, Meghan Cichy returns to the show to discuss our experiences in Washington, D.C. at the National Anti-Hunger and Policy Conference and our time walking the halls of Congress, during which I walked over 2 miles and got a short little ride on a roller coaster from the Senate wing of the Congress building to the House of Representatives wing. Meghan shares what she was listening for at the conference. I was hoping to learn about strategies for increasing access to food for my patients and if Make America Healthy Again had seeped into parts of the national conversations about hunger. Meghan and I get into one presentation in particular, the Mobilizing Healthcare to Strengthen Food Aid Programs Requires Addressing Stigma and Judgment talk, and its surprising similarities to Make America Healthy Again talking points. Through my conversations about MAHA on this podcast and on Instagram, I was able to form a relationship with a MAHA mom who invited me to stay in her ADU while I was there. I share some of that experience today, and Meghan and I compare and contrast what I saw in my conversations with her and in a conversation with a conference presenter. The results may surprise you. We start with the update on the Surgeon General position. Meghan Cichy MPH, welcome back to the show.
Thank you for having me back again.
Absolutely. So glad that we got to spend time together in Washington, D.C. It felt very official business.
It did.
Yes.
Official business and also very fun and interesting.
Yeah. And interesting. Wearing blazers like real policy people.
Mm-hmm. Mm-hmm.
That was good.
Yeah.
And then we got back to news that Casey Means would not be seeing a vote for her confirmation as Surgeon General. What do you think?
Mixed feelings. Mm-hmm. I mean, I think all of those anxieties about like, she's not great, she's not who we would choose, but who else? And like, would they be worse, more concerning, more problematic? Like the risks were high. So now we have nominee number 3. Third time's the charm. I don't know.
It seems like Lisa Murkowski of Alaska was the one or the final no that meant that Casey wasn't going to get a vote. And I honestly was hoping that she would be a no vote because she was talking about the rates of hepatitis B in Alaska and how any discouragement from folks getting that vaccine could have like serious consequences, illness and death. And so it's definitely looking at her, because if she was going to say yes, like we were going to be even more doomed than I thought we were.
Yeah.
But so seems like she was the final no vote. Bill Cassidy got to get out of voting by letting other people say no.
And still got targeted as traitor or something to that effect.
Right.
Not a team player of some sort.
Not a team player. So yes, Casey Means will be withdrawn. And then we get Dr. Nicole Saphir. She is a doctor and a practicing doctor right now. She's completed her diagnostic radiology residency, and she is the director of breast imaging at Memorial Sloan Kettering's Monmouth, New Jersey location. She will also be the 25th person in the administration to currently or previously work at Fox News.
Strange.
That's a lot.
That's a lot.
That's a lot. I thought it was under 5.
Is that corporate capture? Is there like a Fox News capture thing happening here?
Great question.
Or is this like sports have like feeder teams? They're academies, things like that. Is this where this administration is sort of like training and then hiring their staff through this like feeder system of Fox correspondents?
Yeah, like minor league baseball getting pulled up to Major League Baseball. For sure.
You got the call.
Breeding ground for future politicians who are unqualified. And per our episode about Casey Means, Dr. Saphir is a vocal opponent to gender-affirming care.
Yes. One of those, are they going to be worse? Yeah, clearly. Very much so. Vocally worse as it relates to gender-affirming care.
Right. So I hate that I'm like, maybe somebody unqualified would be more, or less harmful like than this other person who I do not think should be a Surgeon General, who might be more qualified on paper.
Yeah. Like there's mental gymnastics here. Yeah. Moral gymnastics.
That's a great way to put it. But MAHA was not happy. Alex Clark said that Dr. Saphir would be a catastrophic mistake on messaging and communicating with MAHA at a time where the coalition is very fragile.
Sounds like that means, AKA, she could threaten Republican votes.
Right. And Alex Clark thinks that if Casey Means is not going to be Surgeon General, that you need to scrap the entire role. She said specifically it's to completely doge the Surgeon General role.
Okay. A role which has limited soft power, generally speaking.
The top doctor, not the top medical director of the United States. The communicator. Yeah. And then Vani Hari, food babe again, doge the Surgeon General. We want medical freedom. If not Casey, we take no one. So
but only medical freedom in certain ways, though.
I was very confused.
We want freedom to not be quote unquote forced vaccinated. But we have concerns amongst the voting bloc about access to reproductive care, abortion care, etc. So there's limitations to our focus on medical freedom. It's just the right kind of freedom.
Yeah, the right kind of freedom. Have you heard anybody who would be actually MAHA, not an Alex Clark Turning Point USA spokesperson, speak to gender-affirming care? Ooh.
No, because they talk about vaccines, raw milk.
Yep.
Glyphosate.
Food dyes.
Ultra-processed foods.
Yeah.
Yeah, but not access to food or anything.
No, never.
Elimination of ultra-processed foods.
Totally. All right. I've heard that people think that Dr. Sphere is going to get in because she's an actual doctor and that people are just going to take her. I'm afraid. Definitely afraid for what could happen.
Yeah, I have heard some pushback around like she's a radiologist. And so that's not like public health focused. And so that's like an inappropriate, appointment in terms of her background. But we do know that the role is very much so a public health communicator, and she has a lot of experience in that with her role with Fox and with her influencer-y podcast and in her Make America Healthy Again book. From 2020.
Yeah. So, Make America Healthy Again, How Bad Behavior in Big Government Caused a $1 trillion Crisis, 2020 book. Yeah. Mm-hmm. Yeah. She attempted to trademark MAHA in 2019, but was not able to do so.
Yeah. Gerardo Fullen in California already had a pending application for the Make America Healthy Again trademark in 2018, but looks like he let that slide also. So
definitely a bummer.
Yeah.
Okay. It was a lot. Back to the conference in DC, or I guess we're still there because all of this is happening. Look at us. We were like there where the magic happens.
Simultaneous.
Yeah. You got there a day before me. So you arrived in DC on Saturday, April 25th. It was an exciting day for you.
Mm-hmm. Yep. It was very exciting. I checked in to the hotel and went up to my room and confirmed that it was, in fact, the Arconia of Washington, D.C., which was exciting. If you are a fan of Only Murders in the Building. I immediately went for a little run to navigate the neighborhood, which is wonderful, except I forgot my hat. It was pouring down rain. I was soaked. I got lost. But I got to find some things that I was looking for. It was great. I got back to the hotel and was soaking wet and starving. Got some room service as per usual, enjoying, a salmon burger on my bed when there was like repeated sirens, like constantly and over and over. And I was like, this is so strange. Is this typical for this area of DC? Because we weren't like by necessarily like the mall or anything like that. We were a little further out and it was just odd. And then lo and behold, I think we were texting and the news came through that there was a little issue at the correspondence dinner a ways down the road that may have been the source of all of the sirens.
Right. It was as I was doing my last minute packing. I always appreciate people who are like packed 48 hours beforehand. That's not me. So I'm doing my last minute packing because I'm about to take a red eye and all of the like news alerts coming in on my phone. And I'm like, oh, and then I put it together. Yes, that you were there. And I was like, oh, Meghan's like right there. This is not like DC seems like a very like nebulous, not real place sometimes. But like my friend Meghan is like just a few miles away from where this is all unfolding.
Yeah. It was about 5 miles away. And then the last night I had to move hotels and then I was like a couple blocks away from the Hilton where the correspondence dinner was. It's like a big, small place. It's like not very far. It does take forever to get anywhere if traffic is doing its thing. But it was like a wild start to what would be a relatively wild couple of days in DC.
Definitely. And I got to stay in a mother-in-law unit or an ADU or however you want to call it of a MAHA mom that I've been privileged to get to know and understand a bit better. I got in around 9. I think I was in her kitchen having coffee at like 10 a.m. drinking out of a MAGA mug. And she told me that she had been at the correspondence dinner the night before, how stressful that was and how she was still recovering, and opens her fridge, discusses, that it was stressful. She had still been shaken up afterwards and showed me the box of Domino's pizza that was in her fridge that they had gotten afterwards. And I was like, that sounds like amazing comfort food. It sounds like you're kind of a real person, which was interesting.
Yeah. I mean, who doesn't need a late night pizza / Taco Bell / whatever run on, the tail end of what I'm sure felt like a really horrific, terrifying experience. Yeah.
Absolutely. And it was a moment of relatability and a time where it was like, okay, you do see what regular people experience. Like you had regular people emotions and had a regular person response, which was to go get Domino's pizza. And like in those moments, I'm like, how do people not like also see the things that other people are seeing? Like, how is this bubble so small and so insular that you don't relate to other people. You don't see other people. I don't know.
Yeah. And that was also like just a regular thing that she's then shared with you, that it wasn't something that was like, did it seem like she was confessing like a sin or like, oh God, it was like so rough. And then we went for Domino's and we still have leftovers and whatever.
It was a mixture. It was after she gave me the MAGA mug. So in irony, like chose that one for me, knowing full well that I didn't want it, but also ironically did. And she was like, oh, and yeah, and here's this, Domino's pizza. You'll love this is how she put it. You'll love this. Yeah. Yes. And I was like, I do. Like,
I do that.
Right. But yeah, the not needing to perform, like clean eating only or whatever. I was like, yeah. So like also real person stuff here.
Yeah. That's cool.
Yeah. So
yeah, you sent me that MAGA mug picture, which I opened in the text when I was sitting in the plenary breakfast. And I was like, oh boy, this is maybe not the crowd for this photo. But I think that was the moment that I was like, oh yeah, you're in a good place. Like you're in a good place. Like you're having like good conversations with a person that is like interested in connecting, independent of like how similar or different your perspectives or views might be.
Yeah. It's been interesting, but I will talk to people and stay and have, great conversations. So a wild experience overall. We got to discuss and like preview the People versus Poison rally before it was starting. So I had coffee and then sped over actually to see you at the Arconia Hotel and use your blow dryer for a quick second, and then joined you for day one. How did you find the conference overall?
I really enjoyed it. I think overall, I got out of it what I was looking for. It's been a while since I've been to a nutrition conference. So it was just nice to be in that space. And because it was the anti-hunger nutrition or the anti-hunger policy conference, it was, bringing together my love for nutrition and food access with my focus on policy. And so I really was curious to hear about and hear from others, community-based organizations, et cetera, about different ways that in my work, we can integrate access to food, social needs, as it relates to food access into the work that I'm doing now, and figuring out the ways that we in my department can facilitate that or decrease barriers or increase the ease of the provision of services for these other community-based organizations that are already doing this work and are doing it well, but within clearly more and more limited resources, more and more limited federal support, and increased obstacles around fear of utilizing services. And, as Trump is, or even Brooke Rollins are sort of shouting from the rooftops how many folks they've lifted off of SNAP, recognizing that those are not people who no longer need that support, but are people who've been removed from accessing that benefit, which is devastating and it's life-saving. It's like these are necessary basic needs being met, but these folks no longer have access to that. And it's only going to get more complicated as more of the HR 1 elements continue to be implemented. That it's going to make things more challenging to access services like SNAP or WIC, because oftentimes Medicaid eligibility or Medicaid enrollment ties into eligibility for SNAP and WIC and can seamlessly integrate the enrollment in those services as well. So as we lose more access to Medicaid, we're going to lose more access to SNAP and lose more access to WIC. The process becomes more cumbersome, and any barrier you put in front of those things means that less people are going to be able to use it. More people are going to drop off of it every time there's a recertification. And that means more people don't have an ability to meet some of their basic needs around food.
Yeah. What did you think about the anti-hunger language versus like food insecurity language that I often see used instead?
I don't think I've really thought about that. It feels more, I don't know, it feels more like an action, like something that we need to do. Like we need to do this thing to stop hunger, as opposed to food insecurity maybe feels sometimes more passive. But yeah, what are your thoughts?
I was introduced to it within the last 7 years. A friend of mine was doing anti-hunger work in DC before moving out here. And anti-hunger was, I was like, why is it not just food insecurity? And it's come down to, you know, the things that you and I and Selena and others have talked about, which is like getting people food. Like food is what we're working with. And yes, the action and like follow through with doing that versus, food insecurity is like this nebulous like term or existence, but what we're trying to address is hunger for people.
Yeah. No, I think that you're exactly right. It's like, this is a thing that exists, food insecurity, but there's no sort of like action around it.
Right. And anti-hunger also makes me think of like any food is better than no food, that type of language as well. And I think with the use of food insecurity, it opens the door for people to talk about nutrition insecurity, or the distinction versus people don't need foods. They need only like nutrient dense foods or stuff like that. Yeah. Versus hunger is addressing hunger.
Period.
That's what I thought. Yeah.
And we have definitions. I'm thinking like, we have definitions of food insecurity. We have definitions of hunger. And I think sometimes definitions, you know, we're trying to get a definition of ultra processed. I think definitions can be helpful because it makes sure we're all talking about the same thing. Definitions can be important because it impacts the way programs operate, the way eligibility operates. But I think so many times people sort of like slip through the cracks in terms of eligibility for things like SNAP, let's say, where they may not meet certain eligibility criteria, but that does not mean that they are not struggling to access, you know, food in a reliable way for themselves or for their families. And I think anti-hunger really also helps make sure that we're scooping everybody up in the process and sort of meeting the folks with the greatest barriers and starting there instead of starting with red dye 40, which is not making any difference for the most hungry.
Not at all. You and I met up in a presentation that was supposed to be about stigma, we'll say broadly accessing SNAP benefits. I was writing furiously at the time. Meghan, you were like fully composed. I would look at my eyesight to you and I was like, Meghan, it's just like thriving here. I don't know if you have thoughts on this presentation, but she just seems to be so chill. And I like, meanwhile, like my leg is, you know, kind of about, I'm giving like raised eyebrows. We were in the front. I was like, are you seeing my raised eyebrow? What you just said, ma'am? I don't know.
I am really good at masking.
Ah, there we go.
Well practiced. And I do think my leg was shaking, but that is mostly like we have to sit there for like an hour to listen to this. However, I just went back this morning and I was looking at like what notes did I take from that presentation. I took 2 notes because again, I'm really just trying to listen for how can I apply this information to integrating social needs, aka food access, into the work that I'm doing at my department. And so slides 6 and 7, those are the only place I took notes. She was talking, one of the presenters was talking about, they went to do a talk or presentation in a rural hospital. Yes. And she was frustrated because they were having issues with the broadband, the Wi-Fi. They couldn't get like reliable connection. And that was frustrating for her. And she didn't really I don't know. It didn't feel like she made the connection that like, that is an access. Broadband access is a barrier to all of these things, healthcare, food access. Like if you've got to go online to fill out a form in order to access these things, or go online to figure out where the address is or whatever, that's a barrier. Broadband access impacts screening and service delivery. But she had mentioned when she was leaving that talk, the CEO of the hospital was sort of walking her out, and he had said, "It's just too bad that we hate poor people." Mm-hmm. And she said, "I know he was joking. Like, I know he was joking." And I was like, I don't think he was joking. He absolutely isn't joking. Like we, America, the system, the infrastructure that we've created, hates poor people. So I don't think he was joking. That was the first sort of like bell that went off. The other one is like, there's a case for food services being integrated into healthcare, like co-located, et cetera. But I think the other like bell that went off was when the other presenter was talking about when she found herself in a position of needing to access services at a food bank. And the way she described how there was no way they were going to have the foods that she needed. Mm-hmm. I don't know if you want to.
That was my first look at you. Oh no, I texted you. That's what happened. I texted you, and you had an emotionally regulated response, and I was like, "What?
What did I say?" Or do?
Yes, there was the lived experience turned policy maker person on the panel who was discussing her experience not having enough money for food, and she was trying to share just her general experience and what things felt like. And she said she had to go to a like food budgeting workshop, and to bring your grocery bags so that you can take food home from there. And she was like, I don't know. They're not going to have the foods that I want to eat there, but sure, I'll just bring my bags anyhow. And she got there and she was like, oh, they have organic food. Oh, they have whole grains. And I was like, oh, ma'am. Oh boy. Yeah. And the irony was the entire talk was supposed to be about stigma and accessing food. Mm-hmm. So yeah, that was definitely a bell that went off. Another was like the talking about food as medicine. They were the first that I heard there talk about nutrient insecurity. And I think it was the medical doctor who was like, it's all nice that we talk about food insecurity, but what I really feel is that it's like a nutrient insecurity. And she had the RFK / Mark Hyman / any foodfluencer picture up that has fried chicken and popcorn and candies and donuts and burgers and soda. Yes, along with the costs of that. Poor nutrition is the biggest driver. Chronic disease. Over $1 trillion is spent on healthcare for diet-related chronic disease. 1 in 2 U.S. adults has diabetes or prediabetes. And I'm like, where have I heard these talking points before? Yes. And then, of course, prevalence of diet-related chronic disease is higher in low-income populations. I'm like, oh, I know where I am right now. This spot feels very similar to the special interests that I happen to have right now. And you had a great thought on that. I was like, this is giving MAHA vibes, but you were like, MAHA and or public health?
Yeah. Yeah. And I can't remember if this was one of the talks where they also linked this all back to money, that like, if we have better access, food access, but also nutrition access, that we like the costs will decrease. I think it was right. Because then you pulled up the original resource, right, where it was talking about the interventions and using food access as an intervention, but it was the interventions also included for other things like housing and transportation. And so they saw these outcomes of decreased burden essentially on the system, decreased like healthcare costs. And they pinned that all to basically eliminating the burgers and the milkshakes and all, that picture as sort of the rationale. And
all of the money was saved just by giving people nutritious food. But the study that they cited down on the bottom had like 5 or 6 different indicators and interventions. Yes.
Yeah. It's like we're hyper focusing in on food. And then the other piece that they were talking about a lot is like the systems. Like these are systems level issues that are contributing to people being in positions in which they are needing more assistance, specifically food access assistance, because that's what this talk was about. But there was like a focus on systems level. But then when it got to food and like the actual food itself, then it was 100% individual intervention. People need to be educated to choose better foods, the right foods, the foods to cure their, put their diabetes into remission, et cetera. And we talked to her about that afterwards, and she doubled down on it and then blamed people for not following her advice because she's now a quote unquote obesity medicine doctor. That's all she does. And people just don't listen. And it's like, gee, I wonder if there's these other things that are happening in their lives that make your advice maybe not as helpful. It's not realistic to sustainably implement, perhaps. Yeah. And then the gentleman at the end who asked a question about, there was an example of this woman who was accessing services. They didn't have the food that she needed. And so she ordered a pizza. The staff would not let her have the pizza because they said that you are too fat to be hungry, I think he'd said. And it's like what they thought she needed was nutrition. Yeah. What she needed was food. She needed to be fed, period. And the way that the panel answered his question was not an answer. It was very much a reinforcement of like MAHA principles with individual intervention for the right foods. And I don't know, it was a dance around.
Yeah. He said, what I think is always missing is people who have access issues, who are unhoused, unsheltered, disabled when it comes to the food as medicine stuff. And sometimes people just need to eat food. And gave that example that you just did. And then the first person to answer was like, well, there's a lot of regulations in like, it seemed like homeless shelters or, service operations. And I was like, what?
That will like prevent them from bringing in a pizza?
Yes. That's why she couldn't. It was like, that's actually not true at all. And the rest of like the panel gave a non-answer. And the whole time I'm like thinking how much I'm going to talk to Meghan after this about how MAHA this presentation was. And I was thinking also in the like plenary, when I was in other presentations, they were talking about how much of a joke RFK is and this administration is, and how they actually don't know what people need. And then I'm like in this presentation with the picture of the donuts, and I'm like, do these speakers know that they are parroting the same phrases, the same stats as the people they think that they don't agree with? And you had something very insightful to say.
Well, and you'll have to remind me because I don't remind me, but I think it was like a very stark contrast between this presentation, which were primarily research people, versus the direct service providers who were giving presentations, the people who were actually there on the ground, connecting with the people who have lived experience of this work in multiple ways, that these presenters, I mean, as much as they tried to like make connections with their personal experience, it felt like they were in theory and not in practice in a way that was problematic.
Yeah. So I walked home that day to walk off some steam and text you. I said, so wait, maybe MAHA is bipartisan if the women today didn't know that they were using all of the talking points. And you said, I think MAHA doesn't really exist. It's the name given to a civic movement to rally the Republican vote, like I've pointed out. But it doesn't really exist as a health movement. MAHA is Republican. Public health is bipartisan, but they are not the same thing, is what you said. Interesting.
I think public health does a better job of using the evidence and trying to, while not always very successful, trying to target interventions at the people who are most under-resourced. Whereas MAHA does not use the evidence base and targets interventions at the things that will most benefit the loudest voices in MAHA who are well-resourced generally than white people. And that's never going to serve the people who are at the highest risk. Even though there's people in that category that might claim to be MAHA because it makes sense. Like some of the stuff sounds good.
Yeah.
I don't know.
It does. Actually, after I got that text initially, I remember walking and thinking, oh, maybe that presentation really just was public health because it was in theory bipartisan. But now that I'm thinking about it, that it was so MAHA, like coded. Nobody needed half or most of that presentation. I see why it could be approved. In theory, there were statistics and there were things cited. But again, it was that manipulation of statistics in order to prove what they wanted to prove. And I was like, that is 100% like what we're experiencing right now.
Yeah. The title of the talk led me to believe that we were going to get sort of content about how to destigmatize these services so that more people would access them, decrease the barrier of stigma. The title is Mobilizing Healthcare to Strengthen Food Aid Programs Requires Addressing Stigma and Judgment. And I felt so much stigma and judgment from the presenters in their presentation around food, around people. And it was none of what I looked for. That was the one I was disappointed in at the conference. I felt like the other talks I attended were much more valuable. And I left feeling a bit more resourced and less frustrated than I did leaving that one.
Yes. I texted you as it started. I was like, ooh, Meghan, it's on. Oh, texted actually you and Selena that what I was in was about stigma surveys and like, Meghan, you're going to love this because it's public health. And then it took a quick turn. You had not been in the room by that, but I had seen the slides go by. I was like, Meghan,
oh, that's right. You got a little preview.
Yeah. I got a preview, texted you, said, you're going to love this. It's about a survey. And then the people were allowed to speak in addition to showing their slides. And I was like, wow, stigma and judgment. What do you think that says about, we're not super surprised because public health, and we've talked here before, is inherently anti-fat and unhelpful for a lot of people. Meghan, what do you think about the contrast between, or what do you think about the stigma and judgment in that presentation and the fact that when we approached the speakers afterwards, they had no idea that they were sharing stigma and judgment?
Yeah, I think it makes me feel a little more pessimistic about our ability to get ourselves out of this, because when the research that's being done is being done by folks who have still really like unidentified, unexamined, unaddressed bias, like we're going to keep getting, if you put bad data in, you're going to get bad data out, right? So and that's not to say that this is like representative of all the research that's happening. I think there's definitely good research that's happening, but I think that we need, as individuals in this anti-hunger work, to really like focus on examining our bias, particularly when we're giving a talk about stigma and judgment and the way that that might be inhibiting our ability to sort of like contribute to the direction that we need to go. Yeah, when we're like just repeating MAHA, RFK talking points, which so far have got us nowhere closer to increasing access to food or decreasing hunger, that's a problem. And like saying that like we might need to like apply for this MAHA money to keep doing our research, and that feels gross. When like you're already like, you'd be fine. You'd for sure get it because everything that you've spouted is already in alignment. So if your priorities are individual intervention for nutrition, nutrient dense, whatever food, you're not actually addressing hunger because like you're too far up the hierarchy of needs, whatever, Alan Satter's pyramid thing, Maslow's, whatever.
Hierarchy of needs.
Yeah. It like, we're not there yet, but we're starting there, which means we're leaving out everybody else, which is what we see MAHA doing, pretty much across the board.
Yeah. And you and I both approached two of the speakers individually afterwards. And I said to the woman who had talked about her experience, like not wanting to go or get, food at the food bank because she had special, she said, food needs. And I was like, did you see that you were saying like poor people food and the food that you wanted to eat? And it took a couple more sentences. And she was like, yes. How do you think I should address that? And I was like, by saying you had stigma and judgment, use yourself as an example. Mm-hmm. And both things were surprising. And I was like, what? No, but also, this is where we are. And then Meghan, you tried to have a conversation with her.
I mean, I was like seeing where we were doing this, like just missing each other, disconnecting. And I was like, let me try to like come at this from a different angle or take a different perspective and more words. And then eventually I just said, like, I think we're still missing each other, yeah. But like, I hope you keep thinking about this. She's well-intentioned. I think they're all well-intentioned and intentions are great, but they have impacts if we're not like learning. And you mentioned that too, like in our training as dietitians, we were there once too, but like we've listened and we've lived and we've understood that actually isn't doing anything towards helping us decrease hunger. Agree.
And I would assume that in the age of MAHA that people would interrogate themselves more, like would like at least start to interrogate themselves and noticing when they're like aligning with somebody that they say they hate. And so that disconnect didn't happen. And when we're talking now, I am remembering how hard that conversation was, the miss there. She didn't seem very curious. She seemed ready to just like go toe to toe and like have a response, not necessarily argue with you at all. Yeah. But like you would say something and she would say something. It was never like, oh, like, tell me more. It'd be like, oh, but if we're, going to talk about nutrition, food is medicine really is the best way. And it'd be like, what about here? But with that opportunity to have coffee with a MAHA mom a couple times, I was able to introduce one, WIC. She did not know what WIC was.
Yeah.
And was really excited to hear about it when I shared it. She did not know about the social determinants of health and was really excited to hear about it. And I was like, how is this information, not specifically WIC, but like intersections and social determinants of health, how is that conversation being better received from someone who in theory wouldn't care about social determinants of health, like in theory is like stigmatizing and judgmental, but is really excited to have this conversation. I don't know.
Yeah, I think everything you've described about your interactions with this MAHA mom is like the literal opposite of our conversation with this presenter. Your MAHA mom seems to be like really curious and coming from a curious stance. Yeah. And I think that keeps us open, right? If we're coming from a curious stance, that gives us an opportunity to learn or like just take in. Whereas like if we've always got an answer, it's like that active listening, like we're listening to respond instead of like listening to learn or listening to take in. And I mean, to be fair, I don't know what it's like to be cornered by two people after you've given a presentation. She wasn't cornered. There was no back against her wall, but there was a wall against her back.
No. Large hallway, large walkway. Yes.
Yeah. And there was tons of other people around. So I don't know if she was like in fear mode. And maybe she realized that like what we were saying, there was some validity to it. And she was, I don't know, maybe she was navigating some emotions around it. But yeah, it would be great if there was like a more of a curiosity around more of that conversation.
Yeah. So definitely interesting dynamic. Appreciated and enjoyed the other talks, especially the one from Indigenous folks. That was nice. And then there was another panel, yes, we were in as well, where somebody talked about farm workers and how, we talked about food and nutrition and farmers, but farm workers had not been discussed yet. And I appreciated that presentation as well.
Yeah. I think anti-hunger, like we're looking at this broad food system, and it's not just getting food to the people, but recognizing that even the farm workers can't access the food that they're helping get out to the rest of the world. And, you know, I also hadn't heard farm workers mentioned in any of the talks either.
Yeah. And then Tuesday, third day, was lobby day. And I'm not sure what I had expected. I'm not sure. Yeah, it said lobby day, like go to the Capitol and talk to people of Congress. And I was like, that doesn't sound right. Like maybe we'll be in like some visual theater or something like that. Like we won't have to, like go
like IMAX screen at the Science Center.
Well, and I was like, how are they going to let regular people into Congress? Like there's no way that they're just going to let people walk in. Like I must have to like sign up or something. Meghan, what'd you think of lobby day?
We did it. I have had interactions at our state capitol with our state legislative process, but I have not had any experience from a federal perspective. So the last time I was in Washington, D.C. was in 8th grade. We had an 8th grade trip. And so we like hit all the regular things, but I think we went into Congress, but we didn't like meet any Congress people. And so when Monday evening, they like separated all the attendees into their different regions, and then the regions separated into their different states, and they kind of game planned. So we all game planned what we were going to do. And it sounds like I'm Washington and Jessica, you're California. There's different, we did that differently. But Washington like identified some separate groups because there was a good chunk of folks. And then we have like our team captain is fabulous. She's been doing this work for a really long time. So she really organized everyone and sort of separated the groups and scheduled all of our meetings with our 2 state senators and then several representatives. All the representatives that we met with were representatives for the districts of the people who were there. So we made sure that we had everyone was able to meet with their representative, which was great. So then we divided and went to all of those meetings, starting in the Senate buildings. And then you have to take like a really long block across Congress to get over to the House buildings. And there's multiple buildings and it's pretty confusing. I was really grateful to have, I did say at least once that I felt like a bit of a passenger princess because I did not have to make any appointments. I did not have to know where I was going. I just had to show up to the first Senate Hart building, get in there, pass security, meet at the big statue thing that you have a photo in front of, which is great, at a certain time. And then we went up to see Senator Cantwell's staff to start with. And it was really cool. It was really cool to see how chill and like ultimately easy the process is of meeting with your Congress people or their staff or both to share the things that are important to you that you want them to be thinking about as they're considering different votes.
Getting into the Congress building, they were like, it's like TSA, allow X amount of time. And I was running late because I'm me. And I'm like, I'm not going to make it in time. It's going to take half hour to get through. Golly, was I early. It took 30 seconds, which was great. Yeah. And then we got to meet with Padilla staff member and Adam Schiff staff member. So nice. So lovely. There was like 19-ish of us on our California side. And in our practice talking points and in the talking points there, they had the person from Food Bank, somebody that would speak really well to WIC, and others, somebody sharing their personal experience using SNAP. And what I found to be really interesting from like my own and clinical perspective is that people were talking about how with these cuts, food banks have been really scrambling with funding and getting folks registered because cuts are coming, through state funding as well. Yeah, the word scrambling kept coming up a bunch. And I was like, I scramble every day. That's what my clinic
Is there
does.
an alternative? Yeah.
Yeah, with every patient, I'm like, oh, so you weren't scrambling and now you are. I'm like, that was just really interesting. It sounded like people were like feeling okay in their jobs, and then this has made it harder. I mean, I love my job. I don't feel like I'm able to do my job to the fullest because people don't have food, and I don't know. So, I mean, it's not easy. It's obviously going to get worse, which is something that we were going to talk about, but I was not prepared, like emotionally or like speech prepared to share my experience. But I really wish that folks know how hard it already is. People are interested in my job and then surprised or like have not put together the fact that I can't do my job if people don't have food. Like that is also something that I found that people were like, hadn't thought through.
And you had mentioned, I think, a text conversation with your MAHA mom talking about how effective individual intervention is for, especially around chronic disease, et cetera. But I think that we miss the reality that for the majority of the population, individual intervention is really challenging to initiate or sustain because they lack access to the foundational resources that would contribute to that sustainability. Food, housing, transportation, livable wage, health insurance, like adequate coverage for health insurance, and then access to providers that are culturally appropriate and, you know, like they can get to physically. Folks in rural areas are going, like all of that's going to be much more complicated also. And so I think that we still, really rely on the effectiveness of individual intervention without recognizing that you can't do your job and the patients can't do their job, quote unquote, when they just don't have access to food or reliable access to food. It's not as simple as the research or the evidence that suggests that that's the best way when the systems don't support that. Yeah.
Which makes me think about the putting nutrition education in medical school. Cool.
I was looking at RFK's, you know, like we're going to start de-prescribing antidepressants because we need to have like informed consent conversations and shared decision making and all of those sorts of things. And I'm thinking about this as it relates to nutrition also, and like, where's the time for the provider to do the nutrition education? Is this nutrition education in medical school going to help the providers to better recognize a need for referring that patient out for nutrition care? And also, like, a lot of these federal programs that support access to nutrition education or nutrition counseling or food prescriptions also have these requirements of having like hypertension or diabetes or quote unquote obesity. But that's also not preventive. So like, why can't everyone have access to those things? Why isn't that just a foundational thing? And if we're concerned about providers not providing informed consent, and I don't know why I finger quoted that. If we're concerned about providers not providing informed consent, I'm not sure that the answer is de-prescribing medication. I think the answer is making sure that they have enough time in their appointments to give a really thorough informed consent conversation and shared decision making. I know that for some shared decision making conversations, Medicaid allows for that to be billed individually in certain situations, but not otherwise. And I don't know that I have no idea what the solution is, but I think sometimes we're changing things to try to allow for better conversations with informed consent in a way that, I know we saw this with vaccines, in a way that's not actually going to do that, because that's not really where the problem is.
Yes. So a lot of what we were talking about with congressional staff was about SNAP, and that was Tuesday. And Monday I had been at the People versus Poison rally. I didn't hear anything about SNAP, and in the Farm Bill, which is what they were talking about frequently, there was no mention of cuts to SNAP. People there wanted folks to be able to eat healthy food. And to them, that healthy food, like being able to eat healthy food, means that it didn't have glyphosate on it, not that they would have access to it, right? 3 hours of not hearing anything about access to food, not just access to glyphosate-free food, was really striking and interesting.
Yeah. And there's like I have not heard any rationale for why MAHA is not concerned with food access.
Mm-hmm.
I haven't heard a good explanation, because it would seem that if we're attempting to make America healthy again, like a really important foundational piece would be consistent, reliable access to food.
Well, and this goes back to me having that conversation. The person I was talking to didn't know what WIC was.
Mm-hmm.
And like, people are so invested in food policy, right? Just general, regular people. They think they are. MAHA moms who don't know what's going on, like what food policy is. But what it is not having glyphosate or red dye. Wild.
Yes, you're right. You're 100% right. MAHA does do food policy. Cory Booker is so excited about the potential for like the way MAHA can support the food policy work he's been working on, except none of it is access to food. Yeah.
Changes.
Oh, but I will say, Alex did mention in her like speech that moms are like feeding their kids Cheerios, which are a part of the WIC package. So maybe that is as close as you'll get to any mention of WIC or SNAP.
That's a good call. Really good call. So the potential MAHA win was that in the farm bill that the House did pass, there was an amendment to remove a provision that would have given pesticide companies immunity from some liability claims. So MAHA moms went from the Supreme Court over to Congress and did their lobbying. I don't know who they talked to. I didn't follow them there, but they're definitely taking credit for that amendment being passed at the last minute. Maybe. And that definitely is in line with a MAHA win.
But they had nothing to say about the fact that the farm bill still passed without, putting back any money to SNAP.
Exactly.
Without doing anything to, expand WIC packages. When we flat fund WIC, that's a cut, because food is getting more and more expensive. When we flat fund or reduce funding for SNAP, that's a cut, right? So like all of these things, SNAP, WIC, are being cut, and there was nothing in the farm bill that seek to correct any of that. But that's not a concern of theirs, I guess.
No.
And two things can happen at once. Like, we can be very excited that we got rid of this immunity protection and communicate, really explicitly that it is not okay that we did not restore funding for SNAP. It is not okay that we did not expand WIC packages. Two things can exist. And I know MAHA has the capacity in all of their available resources, all of their energy, and all of their passion to do two things at once. They can walk and chew gum. They can fight for glyphosate and food access across the board. I'd like to see them rise to that occasion.
Yeah, like there's an opportunity. And it seems like some moms don't know about WIC. Like, so there's the part of me that's like, you just don't care about poor people. And I'm like, did you even know that there were SNAP cuts in the farm bill? I could see that you didn't. I wonder if you did, you would have had something to say about it. I wonder if you knew what WIC was, because you never had to know about it yourself. Would you have cared? Maybe. So again, people who are loud are getting a lot of what they want. People who look a certain way are getting a lot of what they want. So does that leave hope that other people, like those of us who are at the conference and advocating for senators to vote no on the farm bill, can get what we want? Or I don't know. Where does that leave us, Megan?
I don't know. But hey, when you are next in DC, schedule an appointment to meet with your congresspeople. Go in there and talk to them. Send them an email today and ask them to vote yes on the WIC Modernization Act that allows WIC participants to continue to be able to enroll and renew via telehealth, because that is dramatically increasing access. There are like little things that we can do to continue just to allow this digital pathway that will help reduce the risk of people being lifted off of WIC. In addition to all those people who were, quote unquote, lifted off of SNAP. Having people lifted off of these services means they no longer have access to the food that they need to feed themselves and their families.
And Megan, I think that's great. And I think what that trip to DC did was like literally show me those offices. So we walked into like Nancy Pelosi's office and like the people were sitting there and I was like, oh, because these are the people. Like now I'm seeing the people who will be answering calls or emails. It doesn't feel like some nebulous, like I'm just placing a phone call. It's going to nobody's like voicemail box or whatever it is. And it was like, okay, so this, I can see it. Like I can see the difference that me calling or emailing might have for this individual who I see right now. So yes, make an appointment, go into the building.
And it matters. Like they are taking that information in seriously. And factoring that in. So it does make a difference. Even if 10 other people are going to have the same conversation, like your 11th version of that conversation still matters.
Yeah.
And I will just say before I forget, I saved some little baby ducklings with some other folks in DC ahead of our meeting, our meeting with Cantwell, over by the pond out in front of Congress. And that was really exciting.
What happened?
I was very early because I was freaking out, as was discussed at our Monday meeting when someone said, is anyone freaking out about any of this? And I said, I'm freaking out about all of this. I'm freaking out about whether or not, like when I should leave the hotel to walk over there in time, about if I'm going to beep, trying to go through security, like what I'm supposed to do or say when I see these people. So I was very early. But there are these little ducklings that were like trapped underneath the wall of the big pond that's in front of Congress because it's pretty tall and then it's like architecturally rounded or whatever. Like there was no way they were getting back in that pond. And there was a crow who, God bless the crows, love them, but he was picking off the last little duckling in the row. And I was like, oh gosh, should I try to help these ducklings? Should I just like let that crow eat its food? Cause like he probably just needs some breakfast. But I was like, oh, there's like other food. There's like stuff everywhere. You can find something else, crow. So I went over there and shooed him away. And this runner ran by and like tried to shoo the crow, but she kept going. And then this other runner came and like the two of us sort of like did this like corral situation. And we were able to get 4 of the 5 into the pond. And then this 5th one was like, you can't catch me. And it was so fast and it zoomed down the walkway. And there was this man dressed very fancy who had an earbud thingy in his ear. And I was like, sir, stop that duckling. And he did. He like bent down to try to get it. It like tripped over his foot and it was like flailing up on its back. And I was able to pick it up. And then he walked with me over to, he was like very invested. He walked with me over to the mom and we put the baby back in with the mom. Now the mom did peck at this baby. And I was like, I know this baby was with the rest of them. And she didn't have any problems when we put the other 4 in there. But she pecked at him. And then the guy in his British accent looks at me and he goes, I don't know about you, but I'm not going in there. And I said, I agree. I think we can let nature take its course from here. Hopefully that, baby duckling is good. But I decided that this was like an international effort to save the ducklings. And this was like a security detail of the king who was also there that day. Doing a joint address of Congress later in the afternoon, who I then couldn't cross the street for like 10 minutes because they blocked off the street to the hotel when I was trying to get back for his motorcade thingy to come through. And then he like drove by with his little like royal standard flag flying. I was like, oh, the king just drove by. It's such a weird time to be in DC.
Yeah. And also to see like ducks were saved, proper protest outside of Congress. Like you can just use a megaphone and yell about the king being, trash and should not be in our country. You can just do that. I didn't know that.
I'm glad that you sent that picture because I didn't see, like my only king experience was that drive-by and then maybe what I'm just going to guess was a security detail, which could be totally not true, but so I'm glad to have a little bit more of a full experience of the king's visit to Congress.
Just literally on the corner telling everyone that King Charles didn't have sex with Diana because he was having an affair with Camilla. So Diana wasn't getting her needs met. They called him, like, I think King Tampon because of all of other things that
that's a
people
pretty solid
Google.
poster.
Yes. But yeah, you could just talk trash on the corner of Congress, which was great. I was like, I didn't know that. That's amazing.
Well, and I heard Vanny was mentioning that they didn't have a permit for this People versus Poison protest, so they had to be on the sidewalk. They had to be on like the public sidewalk. They couldn't be on the whatever. So then I heard her say like, we were trying to keep it small, but then there were so many people, and then you're like, there was like maybe 150 or 200 actual people versus media. So that was interesting. I don't know what of that is true and what of that is like
trying to keep it small or oops, it turned out to be very small.
Yeah. I don't know. Interesting.
I'll have to Google that. Okay. All right. A journey, Meghan.
Yes. Yeah.
So glad you were there.
I can't wait to go back.
Same.
I think we need to go back.
Yeah. We will. We'll meet up with the same people, see how they're doing a year later, if they know what WIC is. And all right. Thanks for coming on the show.
Thanks, Jessica.
Alrighty, Meghan and I didn't even scratch the surface of food policy, and we'll be back for a breakdown of topics like SNAP waivers in the future. Next up is a discussion about the book Yesteryear, which follows the main character, Natalie, who is building a trad wife empire on social media with her finely curated life and home, living her God-fearing and lucrative life on a farm. Until one morning, she wakes up in a life that isn't hers. Her home, her husband, her children, they're all familiar, but something's off. Her kitchen is warmed by a sputtering fire rather than electricity. Her children are dirty and strange, and her soft-handed husband is suddenly a competent farmer. The story is described as a gripping, electrifying novel that is as darkly funny as it is frightening. And Meghan and Selena Salfin will be back in a couple weeks to discuss it. This has been Making It Awkward. I'm Jessica Wilson, clinical dietitian and an author of It's Always Been Ours. You can find me on Instagram at jessicawilson.msrd. You can support the show by joining the Patreon for as little as $3 a month. My dad welcomes Patreon members to the community. This show is edited by Jen Jacobs, who has yet to put her finely curated life and home on Instagram. This is an independent podcast sponsored by the Legacy of Sacramento Outward Services.